Okay, so let's talk about something that's absolutely central to modern medicine, but is also completely invisible: radiation. It's a tool that saves lives, no question, but using it safely? Well, that takes constant awareness. So let's break down how we do it. And this is the big question, isn't it? If you can't see it, or hear it, or feel it, how do you protect yourself? You can't rely on your gut instinct. Your safety has to be built on something much more solid: clear principles and, honestly, a deep sense of professional responsibility. And we have to be super clear about this right from the start. Radiation is a powerful force for good. It's how we can spot a tiny fracture, how we can map out a tumor for treatment, or even guide a catheter through a winding blood vessel. I mean, it is absolutely essential to what we do. Yeah, you've heard that phrase a million times, and for good reason. Our job isn't just about using the technology, it's about mastering it. And that means getting the crystal clear diagnostic info we need while protecting everyone involved: our patients, our teammates, and ourselves, from any exposure that just isn't necessary. So, how do we actually turn that responsibility into real world action? Well, it all comes down to one core philosophy, a guiding principle that is the foundation for everything we do in radiation safety. And that principle is ALARA. ALLRA is so much more than just an acronym. It's really a mindset. It stands for as low as reasonably achievable. And that word reasonably is the key to the whole thing. It's a constant balancing act. We're always trying to get that perfect, diagnostic quality image, but with the absolute minimum dose it takes to get there. This just hits the nail on the head. Zero exposure isn't the goal. I mean, that would mean we don't get an image and the patient doesn't get a diagnosis. The real art, the real skill, is in knowing how to deliver the right exposure for that specific clinical question every single time. So, how do we actually do ALARA? It really boils down to three simple, powerful pillars. First, time. The less time you're near the radiation source, the less exposure you get. Simple. Second is distance. This one is huge. Because of something called the inverse square law, just doubling your distance from the source can slash your exposure by 75%. And finally, shielding, literally putting a physical barrier, like that lead apron, between you and the source. All right, so we've got the philosophy down. Now let's get practical. Let's talk about the actual tools of the trade, the everyday gear that turns the ALRA principle into a reality. Think of this stuff as your personal armor. Your lead apron protects your vital organs, the thyroid shield covers a very sensitive gland in your neck, and leaded glasses, super important, they protect the lenses of your eyes from long-term risks like cataracts. This is your first line of defense every single day. But here's the thing, all that PPE, it's about blocking radiation. So how do you actually know what your real occupational exposure is over time? For that, you need a silent partner, a little witness that sees the invisible for you. You need your dosimeter. You can think of this little badge as your career-long safety logbook. Now, it doesn't protect you in the moment, it's not a shield, but what it does is tell the crucial story of your exposure over weeks and months and years. It's the hard data that proves your safety habits are working and keeps you well within the established safety limits. You know, it's so important to remember that safety isn't a one-size-fits-all deal. Think about the difference between a CT scan and, say, an interventional radiology procedure. In CT, you're usually behind a protective barrier, focusing on getting the patient positioned just right. But in IR, you're right there in the room. Your priorities totally shift. Now it's all about real-time shielding, collimating the beam tightly, and keeping that fluoro time as short as humanly possible. Okay, we've gone through the philosophy, the tools, and how it all changes depending on the situation. So let's wrap this up by putting it all together into a quick, actionable checklist you can run through in your head every single day. This is where good habits create good safety. Wear your dosimeter every single shift and wear it correctly, on the collar, outside your lead. Don't leave it in the room, because then it's just measuring the room's dose, not yours. Take that extra 2 seconds to check your lead apron for cracks. And don't ever get complacent. Even the most routine procedure deserves your full attention to safety. And that really brings us to the main takeaway here. A lead apron is just a piece of equipment. A dosimeter is just a badge. At the end of the day, your most important safety tools are your knowledge and your unwavering professional habits. Your awareness, right here and now, is the ultimate shield. So I'll just leave you with this final thought. Is safety really just about ticking boxes on a checklist?
Or is it a culture? A culture of safety that you, personally, help build and reinforce every single day with every single patient? It's something to think about. Thanks for joining us.